Hi, in this video we will focus on questions related to the Fick principle in heart failure and the metabolic effects of excess growth hormone. A 72-year-old man presents to his primary care physician for evaluation of worsening fatigue and shortness of breath during routine activities such as walking upstairs. He has a medical history of long-standing hypertension and recently diagnosed heart failure with reduced ejection fraction. To assess his functional status, he undergoes a treadmill exercise test. He's only able to exercise for a short duration of 2 minutes before becoming symptomatic. At peak exertion, his total body oxygen consumption increases by 30%, while his cardiac output shows only a modest rise of 10%. Which of the following is the primary physiological mechanism that enables this patient to increase oxygen consumption during exercise? Now, normally during exercise, oxygen consumption and cardiac output increases, and this is because your muscles need more oxygen, so the heart works harder to deliver it. But in this case, in this patient, the heart can't keep up because of congestive heart failure, but his body is still managing to increase the oxygen consumption. And we should here think that how is this happening? Now, this question is a classic application of the Fick principle, which describes how oxygen consumption relates to cardiac output and the difference in oxygen content between arterial and venous blood. The options given here are A, capacity of skeletal muscle to produce lactate, B, central venous pressure, C, myocardial contractility, D, skeletal muscle oxygen extraction, E, systolic blood pressure. The correct option here would be D, and this lies on the concept of Fick principle, in which the amount of oxygen consumed by tissues is equal to the product of the cardiac output and the arterial venous oxygen content difference. In heart failure, since cardiac output can't rise much during exercise, tissues compensate by extracting more oxygen, widening the arterial venous oxygen difference. Let's have a look at why the other options are incorrect. Option A is incorrect because lactate is the end product of anaerobic glycolysis. An increased ability of skeletal muscle to produce lactate results from long-term adaptations to regular exercise and not from brief efforts like a 2-minute test. And option B is incorrect because central venous pressure reflects preload and doesn't directly influence oxygen consumption. And option C is incorrect because the patient's limited cardiac output increase during exercise reflects impaired contractility from congestive heart failure. So the rise in the oxygen consumption must be due to increased tissue oxygen extraction and not improved cardiac performance. And option E is incorrect because blood pressure reflects perfusion and not oxygen delivery, and while it might rise during exercise, it doesn't directly increase oxygen consumption. A 47-year-old woman presents to a primary care clinic with complaints that her rings and shoes have become increasingly tight. She also reports frequent headaches and hand tingling at night. Over the past year, she has noticed a deepening of her voice and coarsening of her facial features. On physical examination, she has a prognathous jaw, prominent brow, enlarged hands and feet, and a barrel-shaped chest. MRI reveals a pituitary macroadenoma. Which of the following metabolic changes is most likely in this patient? Now, the woman in this question is having classic signs of acromegaly, which is due to excess growth hormone secretion, usually from a growth hormone secreting pituitary adenoma. The headaches are from the tumor pressure, the hand tingling is likely carpal tunnel syndrome from soft tissue overgrowth, and the tight shoes and ring, the facial changes, and the deep voice all are from increased bone and soft tissue growth. In order to answer this question, we should know the metabolic effects of excess growth hormone. The options given here are A. Decreased gluconeogenesis, B. Decreased lipolysis, C. Decreased protein synthesis, D. Increased glycogen synthesis, E. Increased plasma glucose. The correct option here would be E, and that is because growth hormone has anti-insulin effects. It reduces glucose uptake in muscle and adipose tissues, and it stimulates gluconeogenesis in the liver. It leads to insulin resistance, so over time this causes hyperglycemia, and many patients with acromegaly even develop type 2 diabetes. That's why this is the correct answer. Let's have a look at why the other options are incorrect. Option A is incorrect because growth hormone actually increases gluconeogenesis, and the liver is making more glucose and not less. And option B is incorrect because growth hormone promotes lipolysis, which means breaking down fat stores to release free fatty acids, which helps fuel the body during growth and stress. And option C is incorrect because one of the growth hormone's main function is to stimulate protein synthesis, especially through insulin growth factor 1. And that's why patients have increased muscle mass and soft tissue growth. So this option is also incorrect. And option D is incorrect because growth hormone causes insulin resistance, which impairs glycogen synthesis, and it's actually contributing to glycogen breakdown and glucose release.